Hello, everyone. My name is Dr. Ferdinand Usuagu. I am the president of Ferdinand Foundation International. I'm also the vice chairman of Department of Psychiatry at Michigan Health here in Midland, Michigan. I am also the former chairperson of the American Psychiatrist Caucus on Climate Change and Mental Health from 2021 till 2024. And I'm here today to discuss something very important with you. It's about a topic which has a lot of stigma attached to it, and it's about suicide. You might not know, but the World Health Organization actually designates the month of September as the month to create suicide awareness. And September 10 happens to be the date assigned as the Suicide Awareness Day globally. Now, in terms of statistics, we do know from WHO reports that roughly 700,000 people commit suicide every year. And that's a lot of people to lose to suicide. And if you look at the data also, it shows that about out of that 700 people, that comes to about roughly one person every 40 seconds. Think about it. So every 40 seconds on this planet, there is one individual who is committing suicide somewhere. And here in the US also, we are not spared. We also have to face this scourge of suicide. Here in the US, according to CDC data from 2022, it's been shown that roughly 49,000 to 50,000 people committed suicide that year. And that comes to roughly one person every 11 minutes. So suicide is real, and it's a huge public health issue which we need to talk about, and we need to create awareness to help remove the stigma and also help people to get help. The impact of suicide can be extremely profound on the families of the people who attempted suicide. And the theme for the suicide awareness is we need to create hope through action. And how do we do this? There are so many ways we can, do this. A good place to start from is to remove stigma associated with mental health and suicide. We need to discuss this and create awareness, public enlightenment to help people to feel the need to actually get help when they need it. Now, suicide has been associated with so many things, but we do know that one of the key things that you can see is, people start feeling depressed, they start withdrawing to themselves. Then there's this feeling of helplessness and hopelessness that tends to envelop them, that makes them feel that there is nothing to live for again. So when you see those signs of helplessness and hopelessness, it might be time to reach out to those individuals to help them to get help. Now, there are so many prevention strategies that we can, leverage across all levels in the society. Improve access to care. And improving access to care means that we need to help people to get mental health needs when they need it. Engaging people at all levels to help them to promote healthy connections. Most of the research out there shows that people who have healthy connections, it helps people with resilience whenever they go through adverse events, going on in their life. Having support resilience through educational program is also something that would help. And then we need to, of course, keep training mental health workers, train caregivers to be able to respond and help people to, get back on their feet when they're going through periods of helplessness and hopelessness. Now, we are partnering with other like-minded people who will be, sharing their insights about suicide in the next couple of days. And you will be seeing videos by mental health providers and people who have all had cause to work with people with suicide ideation and suicide attempts. And they'll be sharing with you how things has gone in terms of their experience, and also to help to create awareness that we need to help to fight this stigma. This is a call to action for all of us, and the team at Ferdinand Foundation would like to encourage each and every one of us to reach out and be our brother's keeper. Irrespective of where we find ourselves, we should be able to help people if they are going through periods of feeling helpless and hopeless. Thank you very much.